Your doctor will have told you that recent tests have shown that your colorectal cancer might have spread. One or more nodules, which are small cancer deposits called metastases, have been seen in your lung. The question now is what to do about this. Let's watch Dr. Pauline Leonard, a cancer specialist, explain the logic for the study to Mr. David Sinclair and his wife Helen.
So the implications are that despite our best efforts with a combination of surgery and chemotherapy, unfortunately there's now evidence of secondary bowel cancer in your lungs.
So what do we do?
Okay, well, there are a number of approaches we can take. What I wanted to do today was to talk about those approaches. Okay?
Yes.
Yeah. I think it's fair to say first, though, that there are a number of approaches, but there's a great deal of uncertainty about which is the right approach for somebody like you, David, and for patients in your position. So what I'm going to do is talk to you about the ways we could manage you from now on. Now, the first way, you're very well, you don't have any symptoms, and we've picked this up by monitoring you very, very closely. And these lesions are quite small, and we've only identified 2 so far. So it may well be that we could just afford to keep an eye on you with regular scans and blood tests, something we call active monitoring.
So do nothing.
Well, doing nothing in terms of no active intervention, but actually it's a treatment approach, because actually David's actually very well, and because there's some uncertainty about what the right thing to do now is, I would prefer to say it isn't doing nothing, but actually it may be doing the most appropriate thing for David. Because I'm going to go on to talk about the other things that we could offer.
Mm-hmm.
So the other sorts of things which sound like doing something would be either to use some more, but maybe different chemotherapy than you had the first time round. And then we'd be giving chemotherapy everywhere, predominantly to treat the 2 lesions that we could see. But maybe the worry is they may not be the only 2 lesions you have. They may be the only 2 we can see. Mm. So the chemotherapy would be treating everything. Mm. And in some ways that might seem quite a tough thing to offer, because I'd be giving you at least another 3 months of chemotherapy. You're actually very well without symptoms. Mm. And what would I be doing with chemotherapy? Would I just be giving it to watch something get smaller on a scan, or would it ultimately change what happens to you in the future? Again, there's uncertainty about that. And then a third option is, well, if they're the only 2 lesions and there aren't any other lesions anywhere else, would there be a role maybe for removing those lesions? A surgical resection, an operation to take those out.
Would Mr. Kumar do that again, or?
No, it would be a colleague of Mr. Kumar. So Mr. Kumar specialised in removing cancers from the bowel.
Yes.
We would need a special, what we call thoracic surgeon, because
Right.
it would mean a big operation opening up your chest to remove these lesions.
Uh-huh.
Well, I hear what you say, but my first intuition is, if in doubt, cut it out. So get rid of it.
And I think that's a natural response for a lot of people. If it's abnormal and it's there and you can take it out, why don't you just take it out? And I think that's absolutely reasonable.
Well, I suppose in our minds, because you've described them as like small, you kind of can't help but you just think it's a small operation.
Yeah. I mean, would it help to look at the scans and the secondary deposits?
I'm not bothered, honestly.
No, I don't think so. No.
But you are right. I mean, they are small deposits, but that doesn't make it any less serious.
No.
It's the fact that they are secondary deposits from the original cancer. That's what makes it serious. Not so much the size, but the fact, despite the best combination of surgery and chemotherapy, these have grown.
And it's a big op.
it would be a big operation. Obviously in expert hands, but it would be a major undertaking. But I'm very keen to help you. And along with, actually, there's a number of specialists like myself that are very keen to try and learn, well, what's the best way to manage somebody like you, David, when you're in this situation? And because there's so much uncertainty about what the right way forward is, actually a group of specialists have got together and we've designed what's called a clinical trial. It's actually a study trying to address this exact question. For someone like you, David, a number of years after having the right treatment for bowel cancer and now has secondary deposits in your lungs, what's the best way forward? This study is called PulMiCC, and what it will involve is, first of all, talking through what else might be needed, but ultimately the study is about, should we offer you active monitoring or should we offer you surgery? Or do you need some chemotherapy?
Just to summarise, your own doctor, along with many other experts, is uncertain whether or not surgery would be helpful for patients such as you, which is why joining the PulMiCC trial is an option. If you're interested in taking part, you'll be asked to sign a consent form for stage 1 of the study, which is registration of your interest and consent for further tests, which I'll explain in a moment. Then later on, when all the test results are back, you might be invited to sign a further consent form for stage 2 of the study,